Advancing Community and Primary Healthcare in Ontario. If you had not yet had the chance to view our first two webinars in the series, we encourage you to go to our website at www.leadershiftproject.ca and catch up on understanding the ecosystem, overview of the Ontario healthcare system, and making sense of the policies behind healthcare reform. The Leadership Project is a cross-sector initiative funded by the Ministry of Health and Long-Term Care from 2018 through to 2020. Partner associations in this initiative include Addictions and Mental Health Ontario, Alliance for Healthier Communities, Canadian Mental Health Association Ontario, Ontario Community Support Association, the Association for Family Health Teams of Ontario. Leadership aims to give leaders in the primary and community care sectors an opportunity to develop their leadership capacity, ignite cross-sector collaboration, and play a stronger role in the shaping of the future of Ontario's healthcare system. The Leadership Project has many components, including a series of 4 foundational knowledge health systems leaders webinars. The final in this series will come in 2019. Also, we will have a leadership conference in 2019. A career pathways and compensation modeling analysis report will be done. And of course, the delivery of our Leads Learning Series cohorts. My name is Kathleen Thompson, and I am the project manager for Leadership. I will be introducing your presenters today, Dan Carbon and Emily Bedouz of Santis Health. Dan Carbon is a principal at Santis and co-founded the consultancy in 2012 after working for almost a decade in government healthcare policy advisory roles. In Ontario, Dan served as a senior advisor to the Premier, Deputy Premier, and 2 Ministers of Health. He helped drive forward some of the government's signature healthcare initiatives, including the wait time strategy, the creation of local healthcare integration networks, primary care reform, and physician services negotiations. In the UK, Dan worked as a parliamentary researcher for a Member of Parliament and the NHS critic. Dan's private sector experience includes work at the Hill and Knowlton Strategies Canada, in the investment banking industry, and with Goldman Sachs and UBS Warburg in the UK. Emily Bedouz is a consultant at Santis Health, working out of the Toronto office where she supports clients on a variety of initiatives, including policy development, detailed research, stakeholder and government relations, and communication support. Prior to joining the Santis team, Emily worked as a healthcare policy advisor to the leader of the official opposition of Ontario, where she conducted stakeholder relations policy development and provided full cycle support to the leader and caucus to strengthen and improve public policy during the legislative process. Previously, Emily worked with the Mayor of Toronto, assisting with communications and working closely with municipal staff to resolve constituent and stakeholder issues. And so without any further ado, I'm going to hand it over to Dan briefly, and he's going to start us off.
Thanks for that intro, Kathleen. And welcome to the, 100 people that are now on the line of 200 that are registered. We're really excited to be here for the third in this Leadership webinar series. As Kathleen alluded to, the last time that we spoke to folks in the primary care and community care sector was actually just before the election. And although that webinar was framed about the kind of key trends in health policy reform in general in Ontario, a lot of the resulting discussion and certainly a lot of the questions and answers were really focused on the different visions that were on offer by the 3 main political parties in Ontario and what that would mean to the healthcare sector broadly and to your organizations specifically if any of those parties were to emerge victorious in the election. Obviously now we have much more clarity about which party is going to be in government. We have a lot more information about who the key players are within that government, within that administration, how they work together, and emerging information, an emerging picture of how the government operates and what its priorities are, not just in the health and social care sector, but a bit more broadly. So that's really the focus of today's webinar, is to walk people through who those key players in government are, what the government's priorities in the healthcare system are, and then transition into a discussion in terms of what you as leaders, whether you're on boards or whether you're on executives in the home, community, and primary care sectors, what you can do to position your organizations for success in what is almost certain to be quite a turbulent environment over the coming months and years. We do want to make very, very clear that we certainly don't have all of the answers. We're at this early stage in government. All new governments, especially when a party has been out of office for a long time, like the Progressive Conservative Party has been in Ontario, take a while to find their feet. They have to staff up literally hundreds of positions, appointed positions in ministers' offices. They have to really get to grips with the budgetary reality facing the government. They have to establish their legislative priorities. And kind of just as importantly, they really need to land on how decisions get made in government, not just through the formal processes that you might read about in textbooks, but those informal processes of how those different personalities and people within government work together to get things done. So Emily and I certainly don't have all of the answers today. Anyone that suggests that they know exactly what the healthcare system is going to look like in a year is probably selling you something. But I think it's through discussions about what we do know and what we don't know that we really start to get a picture of how the system is evolving and what you as leaders can do. Kathleen referenced the background of both of us in the introduction. I did want to note one additional thing, and that's that Emily has recently accepted an offer from Ontario's Minister of Health, Christine Elliott, to move into her office to serve as a senior advisor, and that will be happening in coming days. So we come at this discussion with interesting perspectives from kind of different ideological backgrounds, and our hope through this session, recognizing that this is a ministry-funded initiative, is to provide you with the best possible nonpartisan analysis and information that will position your organizations for success in that environment. So with that, I'm going to just kind of quickly walk through the agenda, which I referred to earlier. We're going to spend a bit of time introducing the key players in the government, then talking about the new government's priorities and approach to healthcare, and finally what you can do to lead in that changing environment. After each section, we do have a period for questions and discussion. You can enter those through the chat function in the webinar. We're also going to be circulating some kind of live polling questions that will help inform, help us get a baseline of what your current knowledge and comfort level is with a lot of the things that are happening. With I recognize a lot of the names of the people on the line. I know you folks are very articulate, intelligent, and in many cases opinionated about what's going on. So please don't hold back in terms of your questions. And with that, I'm going to turn things over to Emily to get us launched. Thank you.
Thanks, Dan. So I'm going to start reviewing some key players in government and opposition, as well as at the Ministry of Health to get started. So I'll start with our Premier. His tenure as PC leader wasn't very long, actually, before he was elected. Following former PC leader Patrick Brown's resignation in January, Doug was elected by the PC membership at a party convention in March of 2018. Also in that leadership race were Caroline Mulroney, now the Attorney General, Tanya Allen-Granick, a former candidate, and of course Christine Elliott, who came in a very close second in that race. Right now, Premier Ford represents the riding of Etobicoke North, which contains a lot of the Toronto Municipal Ward 2, which he held as City Councillor from 2010 to 2014. That ward is currently held by his nephew, Michael. All right, key players in government. Obviously, Christine Elliott is the MPP for Newmarket Aurora. She was appointed Minister of Health and Long-Term Care as well as Deputy Premier. She previously served as Ontario's first patient ombudsman and also served as the PC Health Critic during her time as MPP for Whitby, Oshawa. Our Finance Minister, Vic Fedeli, also serves as Cabinet Chair and has held the riding of Nipissing since 2011. He was also Finance Critic during his time in opposition from 2011 to 2018. The Ministry of Finance, of course, is responsible for fiscal, taxation, and economic policy, as well as reporting Ontario's economic and fiscal plans to the public through the budget, fall economic statement, which we can probably expect in November, and quarterly reports. Peter Bethlenfalvy is a new MPP in the riding of Pickering-Uxbridge. Prior to being elected this past summer, he held various senior financial roles, including Chief Investment Officer at CST Consultants, Senior VP of Financial Regulations at Manulife Financial, Co-President of DBRS, a credit rating agency in Ontario, and Senior VP of Toronto Dominion Bank in New York. The MPP for Scarborough North, Raymond Cho, has been appointed to lead the new Ministry of Seniors and Accessibility. The previous government created the Ministry of Seniors Affairs in 2017, and former Minister Tracy McCharles was responsible for accessibility, though at the time it was not housed in a ministry. Lisa MacLeod has been the MPP for Nepean Carleton since she won in a by-election in 2006 and was re-elected for the redrawn riding of Nepean in June. She's now the Minister for the Amalgamated Ministry of Children, Community and Social Services, and the Minister responsible for women's issues. Moving on to key players in the Premier's office. First, we have Jenny Byrne, who is a former federal campaign manager and Deputy Chief of Staff to former Prime Minister Stephen Harper. She led the PC's field operations during the 2018 election campaign and now serves as Principal Secretary. This role is most senior politically in the Premier's office, second only to the Chief of Staff. The Premier's Executive Director of Policy, Mitch Davidson, previously served as Director of Policy to former Interim Leader Jim Wilson, former Leader Patrick Brown, and former Interim Leader Vic Fedeli. He also led the team writing the platforms for both Patrick Brown and Doug Ford's election campaign platforms. Larissa Smith is also a former PC staffer under PC leader Tim Hudak. She moved on to work for him again at the Ontario Real Estate Association and now serves as a health policy advisor in the Premier's office. In June, Robin Martin was elected as the new MPP for Eglinton Lawrence, having been elected for the first time in June. Previously, she was a trial lawyer in Toronto and also served as a senior policy advisor to former Health Minister Tony Clement. She is now the parliamentary assistant to Minister Elliott, responsible for health. The PA's role is to support ministers with legislative and committee matters and work with community partners and industry groups. And some of you may recall the previous government, John Fraser, served as the PA to Minister Hoskins, and there his sort of main policy focus was palliative care. Minister Christine Elliott is the MPP for Newmarket Aurora. As many know, she previously served as the province's first patient ombudsman, and prior to that, she was the PC health critic for much of her time as MPP for Whitby Oshawa from 2006 to 2015. I apologize to anybody of Greek heritage who's listening right now as I try and pronounce her name, but Effie Triantafilopoulos is the MPP for the new riding of Oakville North Burlington and Parliamentary Assistant for Long-Term Care. She is a lawyer by trade and also previously held political roles as Chief of Staff to federal cabinet ministers at Treasury Board, Industry Canada and External Affairs, and International Trade. And ministry staff. In mid-June, former Deputy Minister Bob Bell announced his plans to retire. The same day the new PC cabinet was revealed, Helen Angus's appointment was also announced. She comes to health from her role as Deputy Minister at International Trade and Deputy responsible for women's issues. Prior to that, she served as Deputy Minister for Citizenship, Immigration and International Trade and Ontario Women's Directorate. Prior to that role, she was the Associate Deputy Minister at the Ministry of Health for Policy and Transformation. She also held the role of Interim Deputy Minister of Health for 5 months in 2014. She has also held a VP position at Cancer Care Ontario, responsible for the Ontario Renal Network, VP of Planning and Strategic Implementation, also at CCO, and the VP of Research and Analysis at the Canadian Institute for Health Information. Heather Watt is Christine Elliott's Chief of Staff. She also served as the campaign manager for Christine Elliott's local campaign in the general election. Prior to that, she was Chief Strategy Officer at a consulting firm. Laurel Brazil comes from the Ontario Medical Association. She was the manager of government relations and issues, and she also served as Christine Elliott's legislative assistant during her time as PC Health Critic. So here we have a look at the most recent public ministry org chart as of July 20th, 2018. It doesn't look significantly different to how it did prior to the election, but we likely could see some changes in the near future as the minister's policy advances. One position that is out of date is the Associate Deputy Minister for Delivery and Implementation. On August 10th, it was announced that Nancy Naylor was appointed to Deputy Minister of Education, so she will be moving ministries effective August 30th, and her successor has not yet been named. On to the new Premier's Council. The same day the government announced its cabinet, they established the Premier's Council on Improving Healthcare and Ending Hallway Medicine. The council's members are to be appointed, though it is to be expected that they will likely be handpicked by the chair, Dr. Ruben Devlin, who also served as an advisor to Ford during the election. Dr. Devlin is also the former CEO of Humber River Hospital and a former PC Party president. He will report to the Premier, but it's expected he'll work fairly closely with the Minister to develop multi-year plans with recommendations to government. It is also expected that the Council will have a number of subcommittees to focus on specific policy areas, including hospital, home and community care, long-term care, digital health, mental health and addictions, and primary care. Dr. Devlin's time as CEO at Humber River Hospital was marked by its transformation into North America's first fully digital hospital. So it's expected that his experience will likely influence his approach in developing systemic solutions for healthcare. When asked about his vision for healthcare in Ontario earlier this year, most of what he spoke about aligns with what was generally recognized even as by the former government as sort of the best direction for patients and system sustainability. He indicated he'd like to see more care outside of hospitals, better integration throughout the system, more timely and seamless adoption of innovation and better use of technology, and increased access to patient records. None of these priorities are particularly revolutionary, but I think what may be different and interesting to see are the recommendations and approach that this council determines. So Premier's Councils isn't necessarily a new concept for government. I have 3 examples here from previous governments. Dalton McGuinty's Health Results Team was brought together in September 2004 with a mandate to implement specific areas of the government's plan for change, including wait time, access to primary care, system integration, and information management. And Dan actually worked on this team during his time in government, so if anybody has some questions for later about that, he can likely speak to them. Premier Bob Ray's Council on Health, Wellbeing and Social Justice was an advisory body and provided medium and long-term strategies for social change to enhance the well-being of Ontario residents. It was formed as part of the Premier's office and chaired by Premier Ray. It had up to 31 members, of which 7 members were from the Executive Council. And Premier David Peterson's Council on Health Strategies mandate was to examine policy options for the future direction of healthcare and healthcare in Ontario, to establish priorities, and to build consensus for change in partnership with healthcare providers and community representatives. It was established by Premier Peterson in response to 3 reports that came out at the time on health, and the council was part of the Premier's office, also chaired by the Premier, and the Health Minister served as the Vice Chair. This committee also had 5 subcommittees, which we are expecting for Dr. Devlin's council. Moving on to key players in opposition. The Ontario NDP now serves in opposition out of third-party position for the first time since 1995. They won 40 seats to form the official opposition in June. Andrew Horwath has led the party since 2009, and she's been the MPP for Hamilton Centre, which is formerly part of the riding of Hamilton East since 2004. France Gélinas is the party's longtime health critic, having held the role since 2007. She's also been the MPP for Nickel Belt up in the Sudbury area since 2007. MPP Teresa Armstrong has been in her role for London Fanshawe since 2011. She previously served as the critic for seniors from 2011 to 2018 and is now the critic for home and long-term care. First elected in this summer is MPP Joel Harden, who represents the riding of Ottawa Centre and serves as the critic for persons with disabilities and seniors affairs. Betula Carpoche is the MPP for Parkdale High Park, also first elected this past summer. She is an epidemiologist by trade and a public health researcher, and she serves as the critic for mental health and addictions. The role of the opposition is definitely an important one. The NDP now have a higher profile, more resources to work with, and a more significant platform to influence policy and media coverage. So I think it's important to note that just because your MPP is not in government does not mean they cannot affect change. So we'll probably get later in the presentation to the importance of local advocacy and engagement, and I just wanted to note that here. What's different since June 7th? Since the election, there has been some restructuring and amalgamation amongst ministries. The Ministry of Children and Youth Services is now housed within the Ministry of Children, Community and Social Services. That's with the exception of youth mental health care, which will now be housed under the Ministry of Health and Long-Term Care. The Ministry of Citizenship and Immigration has been moved under the umbrella of Children, Community and Social Services. As we touched on earlier, there is now a Ministry of Seniors and Accessibility. Unlike the previous government, ministerial mandate letters will not be made public this time around. And also mentioned earlier, Nancy Naylor is no longer the Associate Deputy Minister for Delivery and Implementation at the Ministry of Health and now serves as the Deputy Minister for Education. So we'll take a break now for questions and discussion.
Who else are the key health policy advisors? Well, that's a question. So there are several layers of who you could consider health policy advisors in this government. And I think Emily spoke to that. First of all, there are the civil service, the senior leaders in the civil service, and we showed you an org chart. Many of those people are the same people that were there prior to the election. The expectation is that the Deputy Minister, Helen Angus, will significantly overhaul the structure and personnel at the senior levels within the Ministry of Health. It was something that came up on numerous occasions during the election campaign that the Ministry of Health in Ontario was overly top-heavy, that there were too many assistant deputy ministers and that it would be streamlined. So first of all, you can expect some changes in personnel there. Second, within the Minister's office itself, the appointed kind of policy advisors to the Minister, as I understand it, maybe Emily can correct me, she is going to be the first that's going to be focused, that will have been hired within that office to focus as a policy advisor to the Minister. Inevitably, additional people will be hired as the government moves along. But I know from my experience in the previous government, it took about a year until all of those positions were filled. And then I guess finally, there are those people that will be advisors on the Premier's Health Council that will have an interface through those mechanisms that Dr. Devlin is setting up to provide advice directly to the Premier and to the Minister. Also, in any government, there are what you could call the kind of kitchen cabinet of informal advisors, people that the policy advisors, the Minister and the Premier meet in the course of their day-to-day work and tend to trust and will call up to get their opinion on things when they're facing tough political choices, and those kind of evolve over time as people get into their roles. Any reason why the mandate letters will not be public? I'll let Emily answer that tough one. I would know, in fairness to the new government, that in Ontario it was only under Premier Kathleen Wynne that mandate letters were made public for the first time. And so obviously it was something that was long debated. And there are questions about whether when you put a mandate letter public, does it become more of a PR communications tool rather than the kind of instructions from the Premier to the confidential instructions from the Premier to the Minister about what their job description really is and how they'll be held accountable.
Entirely honest, I don't have a lot of insight as to why they have not been made public. It could, knowing sort of, we'll get into this shortly, but knowing that the direction of this party in healthcare and other ministries as well wasn't entirely certain throughout the election campaign, perhaps those directions have not been finalized and they don't want to tie their ministers to it. That being said, there are mandate letters that have been circulated to the ministers, so I'll be completely honest, I'm not entirely sure why they haven't been made public.
There's one additional question that was more focused on specific advocacy initiatives and awareness raising related to Alin. We're going to park those kinds of questions until later in the webinar, where we talk about how you can get engaged in, and your organizations can get engaged in advocacy. Okay, so we're going to transition on now to the first in the live poll that will really inform the discussion in the next segment of our presentation. So you can answer that as we proceed in the next section. How much do you currently know about the new government's healthcare agenda and how it'll impact your organization? And we hope at the end of this next section you will know more. So I'll transition that over to Emma.
BC government's priorities and approach to healthcare. Oh, and we have some results from our poll right now. It looks like 28% currently know nothing at all, 68% feel they know a little bit, and 6% feel they are well informed. All right, so as I alluded to before, most of the PC government's commitments, or the PC party's commitments, sorry, during the election campaign were outside of healthcare. That being said, they did have one healthcare pillar, and that was to end hallway medicine. During the campaign, the Premier made 3 major announcements that he hoped would help achieve that. That is to build 15,000 new long-term care beds in 5 years and 30,000 in 10, to match the $1.9 billion federal health transfer earmarked for mental health for a total new investment of $3.8 billion over 10 years, which amounts to approximately $190 million per year. A new dental program for low-income seniors with an investment of $98 million. I will note in the government's throne speech on July 12th, there was also a pledge to work collaboratively with healthcare practitioners, though the Premier did not again speak to the dental program, so that will be something to watch out for throughout the mandate. Few other healthcare priorities for this government are not currently known. As I said before, most of the major promises and priorities were outside of healthcare, but we do know a little bit right now. Shortly after her appointment, the Minister of Health announced changes to OHIP Plus that would make the program second payer to those with existing private plans. The government also announced they will review the evidence of related to supervised consumption sites and overdose prevention sites before any more of those sites are allowed to open. The Minister is currently holding consultations, and a decision is expected by the end of September. Soon after the election, the government ordered a public sector hiring freeze until the true state of provinces' finances are determined. This freeze excludes essential services, new employees required to fulfill collective agreements, and lateral moves. In August, the Premier announced a salary freeze for executives in the broader public sector until a compensation review has been conducted as well. The government's external line-by-line audit will also soon wrap up, which I'll touch on in a little bit, and they're also back at the negotiating table with Ontario doctors. So other broad themes that the Minister, other people in government have alluded to tackling include system and service integration, which we know isn't a new endeavor for this government, but we may see a different approach. Efficiency, which everybody knows is a Ford government buzzword. When the Premier or others in government use efficiency, they're talking about eliminating duplication, perhaps inessential elements or programs or processes that aren't adding value and require resources. It's efficiency in terms of time, in terms of funding, and in terms of human resources, which gets to value for money. They continuously talk about the line-by-line audit as a value for money audit, and we'll get into that in a little bit. Another theme is red tape. Red tape reduction isn't new to this government. The previous Liberal government pledged to address it as well, as did governments before them. The Premier has already announced a red tape reduction roundtables with businesses, but it's yet to be seen how and if this initiative might be applied to the public sector. I've included a quote here of Minister Elliott's address to the Ontario Hospital Association a couple weeks ago. I'll read it. I'm convinced the solution lies in system transformation and building healthcare delivery for the future. Only a system-wide lens will help us plan successfully for how we will care for generations to come. So it's fairly broad, but sort of speaks to her approach in concert with Dr. Ruben Devlin as well. So the focus on efficiency. During the election campaign, Premier Ford promised to conduct an external audit of government spending to find 4% in across-the-board savings, which they would hope would amount to about $6 billion. In addition to the audit, the government launched an independent financial commission of inquiry led by former BC Premier Gordon Campbell. Separate from the audit, the role of this inquiry is to review the previous government's accounting practices to determine if the projected deficit is accurate. And I'm sure a lot of people can recall this stems from a disagreement between the provincial auditor on the government's accounting practices, which would significantly skew the deficit. The inquiry report was submitted to the government on August 30th and is expected to be released at a speech by the Finance Minister on Friday. So what do we know about the line-by-line audit? When I say it's not exactly line-by-line, I mean they didn't go through every government program, all of the spending, and determine its value for money. They gave a relatively short time frame and not a very large budget to conduct this audit. So what it will do, it'll look at areas of spending that has increased more rapidly than others in other parts of the economy and recommend those programs for a targeted review on how to improve value for money of program spending. Ernst & Young was awarded the contract to conduct the audit in mid-August, and their final report to the government is due on the 21st. Echoing the Premier's statement during the campaign that no frontline staff will lose their jobs, the bidding documents explicitly stated that the auditor's recommendations must not include firing anybody. What could this focus on financial efficiency mean for primary and community care? There's no doubt that government agencies like Cancer Care Ontario and eHealth will be under particular scrutiny, again looking for any duplication and ensuring value for the funding that they're provided. It's likely they'll look at mandates and see if there's any revisions to be made there. It's long been rumored that if elected, the PCs would review and revise the structure, if not completely do away with the LHINs. I can say during my time there, I heard that quite a bit from stakeholders as well. It's highly unlikely. That's not something that was ever actually discussed as a policy. That being said, I haven't been there during the Ford government times, but I think there is a general recognition that there is value to the LHINs and they do provide service a specific function. So while it's highly unlikely they'll dissolve the LHINs, it's expected that perhaps the number of LHINs will be reduced, the borders redrawn to better align with existing municipal boundaries. Also, the CCACs were long a subject of criticism of the previous government, and while we know they have, in theory, been eliminated, the practice largely meant that they continue to operate within the LHINs. So there will likely be a look at that function and how it might be better deployed outside of the LHIN. So with that, I'm going to hand it over to Dan to continue on with the presentation.
So one of the questions a lot of people have during the transition from one government to another is what happens to all of those things that the previous government had committed to and told people they were going to do but hadn't yet enacted? And in some cases, what about all those things that the previous government did in its last year in office and that the new government said when it was campaigning that they would overturn or scrap or reverse? And what tends to happen in this kind of first year of a new government is that there's a comprehensive review of all of the commitments that the previous government had made especially when those commitments have been made and but the new government is not contractually bound to follow through. So in the case of where a government has passed legislation, that a previous government has passed legislation that the new government doesn't agree with, but the legislation hasn't been proclaimed or the regulations haven't come into force, those things are often reviewed and considered for just being stopped indefinitely. In cases where funding announcements have been made, but the funding letters haven't, the funds haven't actually been allocated, no contracts have been signed to flow the funds. In many cases, those funding commitments will be stopped or overturned. So there's a whole host of things that the Liberal government announced or agreed to in its last year that this government will be looking at very closely. And the question is, are they going to reverse these things? Are they going to stop them? Are they going to stall them? Are they going to revise them or do them differently? And it really depends on what that issue is, what the policy and the political implications are for the new government. So on things like the $15 minimum wage increase that the previous government agreed to, we're you can be pretty confident that that won't, given the pronouncements of the new government, that will not come into force on January 1st. Given a lot of the rhetoric during the campaign around what the government refers to as safe injection sites and others refer to as supervised consumption sites, we can imagine that the government policy in that will be significantly different than the Liberals. Things like the elimination of the waiting period for OHIP covered home care. It's really unclear where that's going to go. The previous current Liberal leader, the previous parliamentary assistant to the Minister of Health, who was kind of shepherding this through under the Liberals at the time, said, all three parties support this. It doesn't really matter what happens in the election. It's going to go forward. But really, it's up to the new government to decide how they want to move forward. On PSW issues, we've already seen in a quiet announcement on, I believe, August 30th, that the new government scrapped the personal support worker agency that the previous government had introduced towards the end of the mandate. It's really unclear what the implications are for other initiatives kind of aligned with that, the PSW registry and a commitment to a training fund or training facility. We don't know what the status is of the Ontario Caregiver Organization. We don't really know whether the government will ever move forward with the regulations on an agenda that was very close to previous Health Minister Eric Hoskins, which was mandating the disclosure of payments by private sector entities to health professionals and organizations. The supporting regulations to bring that legislation into force were never tabled and may never be tabled. For those folks from primary care organizations, we really don't know what the future holds in terms of what the funding relationships and accountabilities are going to be for primary care organizations. Through the Patients First agenda, the last government had started the shift of moving some of the funding, oversight for nurse practitioner-led clinics and family health teams for new funding anyway, over to the LHINs and transitioning MSAWs for those organizations to LHINs. It's questionable whether that will continue, as we don't even really know whether LHINs are going to exist in the future, or as Emily suggested, whether their mandate and scope is going to be significantly different. I guess the final thing to note, and this is starting to come up quite a lot and create some unease in the sector, is that there are a lot of organizations that don't really know what their financial status is for this year or next. So to use one example, the previous budget that the Liberal government introduced included a 2% rate increase for home and community care services, for example. But that budget never went through the estimates process, which is required for government to actually allocate additional funding to new programs and services. So organizations are kind of in this limbo where they're not sure whether the new government will adhere to that funding increase. And what's more, we're hearing some examples of certain LHINs having committed to in writing that funding increase and in some cases even passed it on, and others not having acted on it. So there's this period of significant uncertainty and instability about whether some of these kind of budgetary commitments are going to be followed through on, whether they're going to be revised or whether they're going to be stopped completely. And as Emily suggested, you'll get more clarity on that when the government moves forward with its revealing some of what it sees as the fiscal picture of the province. And And really, those are some of the key milestones to watch for. So it's the release of the audit report and the Independent Financial Commission report. And the first touchstone on this really will be Finance Minister Vic Fedeli, who will be giving almost a financial state of the union to the province on Friday, where there's all expectations are that the finance minister will report that the deficit is significantly higher than was expected or reported during the last campaign, and as part of that, it's likely due to some of the interpretations that the Auditor General has about how to account for pension assets and liabilities. But the outcome of that report will really shape what the government sees as its fiscal envelope, how much it can spend on public services, what the deficit will be, how much it can allocate for healthcare, and it will force a kind of reconsideration of the budget forecast, not just of the previous government, but also potentially of what the government ran on during the campaign. The next kind of key things to look out for are the fall economic statement in November on the provincial level, or the fall economic statement in November, which is almost like a mini budget, where the government can announce new funding commitments or new funding or spending constraints. And then leading into the winter, the pre-budget consultation process, where generally the finance minister and a committee of the legislature will travel around the province, and they'll solicit input about where the government should either invest additional resources or where it should cut back. And that tends to happen in the kind of November to January period, with the expectation that you'd see a budget table somewhere. It tends to be in the kind of March-April period. So that would be the first real milestone for this new government to signal where it's going, is the 2019 budget, which will articulate a multi-year spending and investment plan that would essentially take it through to the next election. There are two other things to note here, and we spoke to these dynamics in previous webinars. Against the backdrop of this kind of very different and changed environment at the provincial level, you also have, of course, municipal elections underway, and those of you who live in the GTA or Toronto, or even pay attention to the Toronto media market, obviously have seen a lot about the how the province can interact and impact municipal elections. But there is a consistent interplay between municipal politics and the provincial government. And of course, we're not too far from a federal election either, which is scheduled in October 19. It probably seems to many of you, like it does to me, that we just had a federal election, but we're kind of on the cusp of one again. And as we kind of discussed in that earlier webinar, a lot of these cross-cutting issues that impact and might require intergovernmental discussion, negotiation, and collaboration do impact many of the folks in your sector in areas like housing or transit or public health. So there are a host of issues that really the provincial government needs to work through with other governments, including, of course, recreational and medical cannabis, which is getting a ton of coverage as we get within 1 month of legalization. Whole host of changes on the pharmacare and kind of drug pricing side, but also things like basic income. Is the federal government willing to invest in that area now that the province has notified that it's going to be pulling out? Will the federal government and municipal governments be investing more in housing and transit in a time when the provincial government will probably be retrenching? So those are all things to kind of keep in mind as we move forward. And to add to that, I guess, in terms of the nuts and bolts of how things function in this evolving landscape, Emily walked you through almost like the architecture of the new government, the org chart. Here are the people and the roles and the positions that they fill. But that's not really what government is or how government decisions are made. Those are, as alluded to earlier, those are much more informal processes about how power is exercised and what the informal conventions are between people about who gets to make decisions. So although the Minister of Health has a defined role, there's in every government and in different parts and times in government, there's going to be ongoing tension between the Minister of Health and the Premier about what level of autonomy the minister has. And when you add to that something like this Premier's Health Council, it creates an additional dynamic altogether, which is, what's the working relationship like between the Premier's Health Council and the Minister of Health? What's the working relationship like between the Premier's Council and the Premier's office and the rest of Cabinet? And those are things that we won't know the answer to right away, and will continue to evolve over time. In addition to that, there's a couple of other things that have major implications for the government. In a time of fiscal constraint where the government is trying to cut $6 billion of public expenditure, they're also facing, they're trying to land an agreement with the Ontario Medical Association, who has put forward a very ambitious ask for additional funding. I think if that were agreed to, it would significantly impact the government's ability to fund other parts of the healthcare system. And I guess underlying all of this or behind it is, what does this overall fiscal picture look like, and what are these various audit processes uncover that are going to be addressed by the government? I think one thing that is instructive is to remember that governments don't always act once they get in government as they would have committed to during the campaign process. So Dalton McGuinty was elected on a commitment not to introduce any new taxes. They went through a similar process of looking at the provincial books, and lo and behold, to them they came to the conclusion that there was a $6 billion deficit that the previous government hadn't reported. Their response to that was to introduce a new tax, a healthcare premium. Before that, when Mike Harris came into government, he didn't come into government essentially saying he was going to take a significant axe to hospital expenditure, but when he looked at the books and the government and the cabinet came to a decision, they ultimately landed on a plan that saw them attempt to cut hospital spending by 5%, then 6% and 7% annually, which is almost unimaginable today. They ultimately abandoned that third year of cuts and started reinvesting in the healthcare system. But I guess the key point is, we really don't know until the government goes through some of these processes how it is going to address some of the key challenges in the healthcare system and how much investment is going to be available to the healthcare system. And with that, we're going to transition over to some questions and answers.
Okay, great. Our first question is, are doctors and nursing positions exempt from the public sector pay freeze? My understanding about the pay freeze is that it was targeted at executives of the broader public sector. So I think it was the hiring freeze that was throughout the public sector. I do know nurses were exempt from that. So the pay freeze, from my understanding, does not apply to nurses, obviously, especially with collective agreements, and doctors.
There's another question around changes to the Employment Standard Act changes that the Liberal government introduced in the past year. I can't confirm that. All I can say is that there are many people that I've spoken to who anticipate that the new government, will introduce legislation to significantly overturn or reverse many aspects of that legislation. And that is a priority for introduction. Again, that is informed speculation. We haven't seen a piece of legislation yet, but there, not just in terms of that piece of legislation, but we've also there's also been a lot of suggestion that the government will revise things like PSLRTA legislation, which governs the transition of staff within the healthcare system. So I think it would be a pretty fair bet to suggest that will be reviewed pretty quickly. There's a question here, how committed do we think the government is to a 4% cut in each department? Given that parts of healthcare are untouchable, wouldn't this mean a much higher cut for the rest of us if they're determined to fulfill it?
I'll say it's ambitious. I think what Premier Ford, and at the time as a candidate, was feeling as though there is significant duplication. I'm not sure. It would be an average of 4%, so that's not to say that they're looking for 4% in healthcare. I think the feeling is that there's significant duplication as ministries and bureaucracies grew over the years, and I do know he's a big proponent of the Lean Six Sigma processes. So I think he was coming at it from the perspective of perhaps a businessman, and I think the audits of spending will inform those decisions.
I'll just add to that, and under the previous government, the fiscal plan to try and get back to balance, which was obviously a pretty short-term period of being back in a balanced budget, but that long-term austerity agenda on the heels of the great financial collapse in 2008 was really built on the backs of the other sectors outside of healthcare. So although it may have felt for those who are primarily funded by the Ministry of Health and or LHINs that times were tough, the Ministry of Health continued to get annual increases. Sometimes they're only 1.5% or 2%. It averaged, I think, 2.1% for over a period of 3 years. But if you look at the budgets of other departments across government, the other 60% of programmatic spending, they had outright reductions each year. So that is a dynamic that the new government will have to address. They will look at a savings target, and then they'll have to identify which parts of the budget, in a way, are they most able to inflict funding cuts on, and where's the human damage going to be the least, and where's the kind of blowback going to be the least. And in some cases, given the importance of healthcare to provincial governments and to the public, it is an area where the cuts tend to be much more shallow. Okay, there's another question about Bill 148 that I addressed earlier, which is we'll have to wait for the legislation, but it's almost certain that there will be changes introduced. We're going to shift now onto the next live poll, and that is, how many of you know your current MPP, your representative at Queen's Park, and or their staff? These are the folks that would have just been elected a couple months ago. Okay, that's great. So the results for this are quite a bit different than the previous question, in that around half of you, to some extent or to a great extent, know who your MPP is, which I would say is far more than the general public. It is a sign that you're more actively engaged in public policy issues than most people, which is fantastic. We're going to actually shift in this section to what you as organizational leaders can do in this changing, somewhat uncertain environment. And the first thing, which obviously many of you are doing, is really to get and stay informed about the government's agenda. Now you have provincial associations, and those associations, part of the work that they do is to provide updates to the membership on new pieces of legislation, new major policy initiatives, when they have meetings with the minister or the premier's advisor or the premier's office, and what kind of comes out of that meeting. And it goes without saying that you should obviously read that and stay informed. But the other thing you can do is try to really stay informed by just reading the paper, the online websites. There's one called Ontario News Watch that I kind of watch each morning, and just give, 2 minutes, you get an overview of everything that's happening at the provincial level. Because in this period of time when there's so little information on what the government's agenda is, it's really important to pay attention to those landmark announcements, policy pronouncements, and speeches to get some kind of idea of where the government is going on key issues. In the Soviet Union, there was a form of there was this there's this joke about Kremlinology, where people would study the pronouncements of government in the newspapers and be able to discern, in a way, from what was said obliquely and what wasn't said, what the government was actually thinking, what they were contemplating, what they were not making decisions on. So it's sometimes really important to see when, the Minister of Health is answering questions, what they're not saying in response to questions, and what that could mean for the healthcare system or your organization. But just this process of educating yourself in an ongoing way is really important, especially for senior leadership, and about how to guide your organization strategically. So and really that comes down to understanding what the government is doing, what they're considering, and how they're framing the challenges and opportunities. This becoming informed is really a prerequisite, I would say, to effective engagement, because without it, you can't possibly understand how to align your organizational or your sectoral goals with what the government is hoping to achieve, and basically convey the opportunity for shared value or a win-win. So there's a number of ways that you can get involved, and the formal mechanisms are perhaps the most straightforward. There's things like, so Emily talked about the Premier's Council setting up a number of subcommittees. Those subcommittees, once they get established, will probably have some engagement mechanisms where they'll talk to groups of people, or they'll post public consultations, or they'll post something on a website where you can send submissions in. So you can participate in those and send things in, send ideas in, attend those meetings. Through the legislative process, they'll go into a little more depth in a second, there's opportunities for clear engagement. Through the budget process, there's opportunities for clear engagement. And these are the things that in a way are built in so that the government is able to hear from the public and from interested parties about key things that it is doing. But I would suggest that far more important than those formal mechanisms of engagement, although they are important, are really developing informal modes of communication with policymakers and political leaders. It's really ultimately about developing relationships and trust with people that are able to influence the public policy process. And these are things like attending your local MPP's barbecue or their picnic and talking to them there, inviting your MPP or their staff to come to your organization to present at a board meeting, to do a walkthrough of your organization, to learn what you do. Now, I think almost all the MPPs in Ontario this week have taken a couple of days off to go to this thing called the International Ploughing Badge. And I mean, I don't know how international this ploughing badge is, but it's full of all of these folks from rural Ontario who gather, and the politicians put their plaid shirts on and wear funny hats. And it's an opportunity for people there to go and talk to people in an informal way and raise issues that really matter to them. And those tend to have, that's a way of establishing relationships and being able to get a call back and a fair hearing on an issue when it becomes urgent. So one of the things we talked about as a formal engagement mechanism is really legislation. And we're really expecting quite a bit of legislative change. So people talked about Bill 148 revisions. There's certainly expectations that the Minister of Labour will be, burning the midnight oil to work on that. On the healthcare front, there's, potential changes to things like PSLRTA, the Public Sector Labour Relations Transition Act. And then there also is expected to be significant changes to the Patients First agenda that would really change the roles of LHINs and CCACs fundamentally. So these are kinds of things that you need to, as associations and as leaders within associations to be cognizant of and aware of how you can participate. So generally, the way you can participate most effectively in a legislative process is, well, it goes without saying that before a legislation is introduced, if you catch wind of it and you're consulted, it's great to be able to influence that process, provide information and consult on it before the bill is introduced for first reading in the legislature. But once it's introduced, it's essentially a formality. In very rare circumstances, only when the government introduces a piece of legislation that it's not really confident in or comfortable with, will it send it out for a revision after first reading. And that happened with, I think, 2 or 3 pieces of legislation I can remember from the last government, including one that was called Bill 8, the Commitment to the Future of Medicare Act, where they sent it out after first reading because it wasn't fully thought through, and they wanted people to be able to help shape the bill. But most of the time, legislation goes immediately to this kind of second reading where if you've got a majority government, they kick it over to a committee for public consultation. So if we flip to the next slide, this was the process under the previous government for Bill 41, the Patients First Act. So the bill was introduced on October 6th. It finally got scheduled for second reading debate. They debated it for about a week. Then they referred it to the standing committee. Then after second reading, it went out for public consultation for a period of 9 days. And during that time, it's pretty exhausting for the members of provincial parliament. They usually travel to the 4 corners of the province, and they sit in all-day meetings where people come forward and present their ideas on how to make the legislation work more effectively. And that results in the committee getting back together and reviewing a a lot of amendments that could be tabled by the government or any of the opposition parties. And in this case, they voted on 94 different amendments at that committee process. Many of those would have been advanced by stakeholders, written by stakeholders, informed by stakeholders. So that is an opportunity for you to participate in the process, put your ideas forward, and really shape the final outcomes of bills. Because once it gets back to the legislature after that committee process for third reading, it's essentially a slam dunk. It's a formality. It will get passed, and then it will get sent for royal assent to the Lieutenant Governor and Council. So alluded to earlier the importance of you knowing who your MPP is, which it's great that 50% of you already do. There are 73 new MPPs on June 7th, so many of these people won't even really understand where the bathroom is in their constituency office yet, or might not have any staff. So the fact that you know who they are in many cases is great. But they come from very diverse backgrounds. Emily, when she was talking about the backgrounds of the other MPPs, talked about how one was a trial lawyer, one had served as a VP at a debt ratings agency, another was an epidemiologist. The one thing in general about new MPPs is that unless they've served as political staff, most of them know almost nothing about politics, and they come into it very, very fresh, and there's an opportunity for you to help educate them about their community, about what matters, how the healthcare and social care system operates, and to build a kind of trust-based relationship, even if you don't agree with their politics. It's really important for you to kind of get this relationship with them so you can demonstrate what your organization does and how it why it's important to them within their community. And that will help you through your MPP, which is another channel, influence government policy, legislation, and regulations. All governments enter government in the first year thinking that backbenchers and caucus doesn't really matter and they can do whatever they want. By the time they get a little bit longer into their mandate, the third year or so, they start listening a lot more to caucus members who are really concerned about getting reelected and about their jobs. So those MPP relationships, no matter whether those folks are ministers or backbenchers, is really important. And although associations do this for you centrally at Queen's Park, they don't have that reach into all of the communities, to the 100 plus MPPs, the 73 new MPPs. So it's really contingent on you to build those relationships and advocate for your organization, for your clients, and for the sector. And the kind of basis for this is really, from an educational point of view, getting your MPP to know who your organization is, who you serve, and what you do. Why do you exist? What's your value contribution? How do you contribute to your local community and the system overall? And then what are the key challenges you're facing and the opportunity? What are the things that they as members of government can do to fix things? And then from an advocacy perspective, your job is to make public policy better, more responsive to the realities on the ground. Politicians are trying to do the best they can within their abilities to improve public policy, but they don't know everything. They're generalists who know, most of them know a little bit about everything, but not too much about anything. So your job is really to try and work with them so that they understand what the opportunities are. The association will do that, as we mentioned, providing a unified, clear, and consistent ask with the health minister, with their staff, who are generally more informed on your issues than MPPs will be. But you have the opportunity to really do that at the local level and align your public policy advocacy work with what your association is doing. And then put you in a position to request support and action from your MPP. And this is really the bedrock of how strong, effective democracies work, is that individuals, organizations, and civil society spend time to engage with their elected officials so that they know what the opportunities are for public policy improvement. And that's it. I think we're going to turn things over to questions now. I think Emily addressed this earlier, so maybe I'll flip it to her. It's about the public sector salary freeze. To date, we have nothing in writing. Where can we find specific details outlined?
I believe on the government's website there is a note from Steve Orsini. And outlining, it's basically a message to the public sector, to the deputy ministers and ADMs, outlining this. So I don't know if we've got a mechanism for this, but we can probably direct people where to go to find it.
Yeah, we could send a link around that. I think it's fair to say that there's a lot of confusion about some elements of this directive at the moment in terms of how it impacts not Ontario public servants and employees of government agencies, but those who are transfer payment recipients, and whether there's any implication for them at the moment. You know, just as operating as a consultant, for example, there have been some clear messages regarding the hiring of consultants, and we've been told essentially that government-funded organizations, agencies of government, can not hire new consulting contracts without some kind of exemption. However, there's no such restrictions on hospitals or other service providers, although some are choosing to act and proceed cautiously. So I think that there is some lack of clarity there, and that'll probably be addressed in coming months. Interesting question. How long do you think it'll take to implement the rumor changes in status of LHINs and CCACs should they happen? I don't, you know, that's a really good question, because the government, any government, clearly wants to do the hard, unpopular, disruptive work in the first 2 years of its mandate. So these structural changes, which could over the short term destabilize the system, should be expected to be launched within the first year of the government's mandate. But part of the question is, who's kind of calling the shots and making the ultimate decision on what that's going to look like? And I would say, having talked to some people that are influencing and informing government policy on this, there's still a lot of unanswered questions. So the government is essentially looking at significantly scaling back the role of the Ministry of Health, significantly scaling back the role and number of government agencies, and significantly scaling back LHINs and CCACs. Well, as Emily stated earlier, there are a number of kind of core functions within those organizations that you cannot just you can't just drop completely. Decisions still need to be made. There still needs to be system oversight and accountability. So there really needs to be still a bit of an effort, I think, and I think that Dr. Devlin's work is going to do this, to look at the overall system architecture, to talk about in a new model, where does it make sense that some of these functions go to? And some of that will likely be to the health service providers themselves, to more kind of, there's a lot of talk about more integrated service delivery options. Some of those functions could get devolved to frontline service providers. Others could get reallocated. Some might be ended totally. But I don't think that's fully been mapped out. But the best guess is that you would see some aggressive action on this within the next year. The other thing we just note is that this government has shown a couple of things. First of all, it will make changes that it hasn't necessarily signaled in advance, as with the changes to the size of the Toronto City Council, or that were in the previous election platform. And second, it doesn't necessarily feel the need for substantive, long-term consultation before changes are made. So I would think it would be extremely unlikely that, as Eric Hoskins did, that they would table some kind of white paper for 6 months or 8 months to get everyone's feedback before they'd introduce some changes. There's more likely to be internal deliberation and then pretty rapid movement towards legislation, I would suspect. Okay, we're going to move to the final live poll now, and that's, you know, based on this, does your organization currently have a plan on how to engage the new government? No, or well, we're working on one, or yeah, we have a plan in place and we're doing stuff. Okay, so that's getting the results, and it's split about 50-50 between those who don't have a plan at all and those who are kind of working on one. Our suggestion would be that this is an ideal time for the board and senior executive team to discuss what those things are that you as organizations hold sacred, and how you're going to advance the interests of the healthcare system and the needs of your clients, because we are likely to enter a period of profound change, and you will have a role in shaping where things land only if you engage in the process with a well-considered plan.
Okay, well, thank you very much to Dan and Emily. Stay tuned as we will have a fourth webinar to deliver in 2019. Specific subject matter is sort of yet to come. I encourage you folks to share the recording with your colleagues when that comes available to you probably later this week. And I hope now that some or most of you have a better, more firm understanding as to how to go about engaging those really important new relationships with our new government to make the most effective efforts for change and engagement. Thanks very much again, and if you would like to learn more about the LeaderShift project, please go to www.leadershiftproject.ca. And if you'd like to connect with us for any questions and concerns that weren't addressed during the time frame of the webinar, you can connect with Nicola there, and her email has just been put into the main chat box. So once again, thanks to Emily and Dan, and we'll see you next time.